Some people with ADHD are not diagnosed until adulthood when they struggle with impulsiveness, restlessness, or difficulty paying attention. Upstate now offers a program specifically for adults with attention deficit hyperactivity disorder, and today I'm talking with the person who oversees that program, John Ringhisen. He's a nurse practitioner of psychiatry and behavioral sciences and a member of the pharmaceutical subcommittee of the U.S. Guidelines Task Force for Adult ADHD through the American Professional Society of ADHD and Related Disorders. Welcome back to The Informed Patient, Mr. Ringhisen.
I appreciate the invitation. It's good to see you again, Amber.
Let's start with a description of ADHD. Is this a mental health disorder or a physical disorder?
It's a mental health disorder. Attention deficit hyperactivity disorder is a cluster of persistent behaviors that make completing tests difficult and generally fall into two broad categories. You have either trouble remaining focused or you have trouble remaining still.
So, how does it manifest in adults compared with kids?
In adults, it usually starts to manifest where people start really struggling professionally, is where they usually see it first. They have difficulty at work completing tasks, or they have difficulty in the home, if the home is the profession, with staying on top of appointments or staying on time on a task in the home, to where simple tasks like laundry or cleaning dishes or taking care of children starts to pile up on people and starts to feel very overwhelming to people. The amount of time to get tasks done seems much longer than what it should be. And that often starts impacting how they see themselves or how they see their performance.
Do most adults who have ADHD, do they develop this as adults, or is this something that they probably had and it went undiagnosed throughout childhood?
There's a lot of research out there that's really trying to come to a succinct answer on that, because the answer is probably somewhere in the middle. It's both. There are some individuals that possibly do start to exhibit symptoms later in life. And there are individuals that, because of either lack of resources or lack of being engaged with a mental health provider when they were younger, typically through the school system, they weren't picked up as ADHD when they were going to school, or maybe they left school early and for whatever reasons that they had to. And so they've never been engaged with anybody in a capacity to be able to determine whether they have ADHD.
What's the oldest age person that you've seen diagnosed with ADHD?
The oldest in our clinic that came in diagnosis free was a gentleman that was 57 years old. And we do have individuals that have been previously diagnosed either in childhood or even in middle adulthood that are continuing in our clinic that are well into their 60s and retirement age.
How likely is it if an adult who feels like they have trouble focusing actually has ADHD? Because it seems like maybe there's some symptoms that could be ADHD, but maybe they're not.
Yeah, that's what makes an ADHD diagnosis very tricky. Things like depression, anxiety, and other things that we struggle with in daily life, trauma, and some people's personalities can start to look like ADHD. For example, with anxiety, you just have to really dig into why you're so distracted, or what's the root cause of what pulls you away from being able to focus on things. Because if it's your anxiety getting the better of you because you have intrusive thoughts, possibly from trauma, or you're persistently worried about things that are overwhelming you in your daily life, the distraction is more a step two or a result of being very anxious, and it presents like ADHD, but it's not truly related to being an ADHD diagnosis. And similar things can happen with depression as well.
So let's talk about how an adult typically gets diagnosed and the program that you oversee. Do people come there already diagnosed, or do they come to you to potentially be diagnosed?
Both. And we go through a extensive screening process where there's a survey item where it's a self-assessment. So that means that it's a document that we give the patient in the waiting room and they fill it out, assessing themselves on a lot of the symptoms and some of the behaviors and some other questions that we ask that give us a sense of whether ADHD might be something that we would suspect in the individual. We also encourage people to consider bringing a support person, because a lot of times with adults, being able to assess themselves is difficult. And so having a spouse, a friend, a loved one who knows you well and that you trust having present at your appointment is helpful. And getting some of the collaborative, meaning the people around you's opinions of kind of how you're presenting. A real good example of this is one of the questions it asks is, do you often interrupt people, or do you often find yourself shifting topics quickly during conversation? If you do that as part of your natural conversation style, you might rate yourself very high. Or there's some people that underscore themselves, and then their wife kind of nudges them and says, you interrupt me all the time. And so it becomes a bit of a laughing point and breaks the tension in the initial interview. But what we're trying to get at is what's happening around the individual. How is your environment reacting to your possibly having a true ADHD diagnosis? And how your environment reacts to you is very important in being able to accurately diagnose ADHD.
So it sounds like it is challenging or could be challenging to diagnose this. There's not a blood test, there's not some medical test that would tell you whether someone has this or not.
Correct. And there is what's called neuropsychological testing that a lot of people put a lot of faith in when it comes to, can I go someplace and do a one-stop test that will tell me whether I have ADHD or not? And it's dubious, because what neuropsychological testing really tells us is, how severe are your symptoms? And do you have symptoms? And how much are your symptoms impacting your ability to function in your daily life? It doesn't really get into causality as to what's making those things happen and why you're struggling so much. And that's why it's very important to have a conversation with a mental health professional and sit down and interpret those test results to see if an ADHD diagnosis is appropriate.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with John Ringhisen, a nurse practitioner of psychiatry and behavioral sciences at Upstate, who oversees the new adult ADHD clinic. What does treatment for adults generally consist of?
In our clinic, treatment for adults consists of a multifaceted approach. We encourage psychotherapy, which is talking to somebody in talk therapy, working through skills and coping strategies that will increase their ability to function. We offer supportive measures at school or work if accommodations are appropriate, particularly in academic settings. We have a lot of adult learners that come to us where they want extra time on tests, or they want a different testing environment. So we can write supportive letters to provide those kind of accommodations. We provide medication for ADHD through our clinic. We are a full prescribing and medication management clinic. And then we're getting into and exploring coaching. You can kind of think of these as, when we talk about substance use, we talk about peer advocates, people that have kind of been there, done that, and then have struggled with addiction before. We're finding individuals in the community that are becoming coaches, where they struggle with ADHD themselves, and having somebody who has experienced and overcome the struggles associated with ADHD can sometimes be helpful and supportive to somebody, particularly an adult.
Your program focuses on a non-stimulant first approach.
Correct.
Can you describe what that is and why it's important?
What we mean by a non-stimulant forward approach is the medications that we prescribe for ADHD are kind of broadly broken into two categories. There's the stimulants, which is what everybody's probably more accustomed to associating with ADHD medication. That's Adderall, that's Ritalin, Vyvanse, Concerta. And then there's the non-stimulant medications, clonidine, guanfacine, Quellbree, atomoxetine. The reason that we focus on the non-stimulant medications is because stimulant medications are controlled substances, meaning that there's a lot of rules and regulations from the Department of Drug Enforcement and federal regulation that govern how much we can give a person at a time. We can only provide 30 days at a time. And the reason that these medications have extra restrictions around them is because they have been associated with misuse, building up tolerance and dependence. And so they have to be very closely monitored from a health standpoint and from an addiction standpoint. So the reason that we use a non-stimulant first approach in my practice is to try to reduce the reliance on stimulants in the population. There's also been, and it made national news, that there was a nationwide shortage of stimulant medication, which has also kind of prompted us to try to use more non-stimulants in our patients. And there's also good evidence where if you are a significant responder, meaning that your symptoms get better on a non-stimulant medication, you can have as good of an outcome as you will with a stimulant. Now, it does take a little bit longer for the medication to take hold. It takes a few weeks versus days with a stimulant. But the convenience of not having to worry about constantly finding a provider, the health implications of not being on a long-term stimulant for your heart, for your overall health is much better. And so it's what we offer first, and particularly patients who have never been on medication before, specifically for ADHD. We put that forward as the try this first option. And then, of course, if they're not a good candidate for the medication, or if they just prefer to be on a stimulant, of course, the patient's decision is going to be what ultimately decides the treatment that we prescribe. But we try to offer the non-stimulant as the first trial of medication for patients who have never been on medication before.
Can you explain how a stimulant would help someone who's already hyperactive?
It's actually the non-stimulants that work very well for people that are hyperactive. So if moving around and holding still is where you're really struggling, stimulants oftentimes can make that worse if it's truly a hyperactive presentation of ADHD. Now, if the reason that you're moving around a lot is because you're easily distracted, you're getting up and you're moving around because your focus is off, then that symptom will actually improve with stimulants.
So this, it sounds like, is a very individualized treatment plan for each person.
Correct. We take into consideration, as nurse practitioners, a holistic approach to care. And so we take into consideration what's their work schedule, what's their outside of work schedule, what's their personal schedule. When do they need to be performing at their peak performance or their optimum levels, so that way we can time when the medication is at its best. Some people need to be early risers, very effective in the morning. Other people need it later at night. We try to time that and try to individualize and customize care as best we can.
Are there coexisting conditions that you see typically in people with ADHD, and how would you handle other conditions that this person might have?
The other conditions that a lot of people have when they present with true ADHD is there's usually depression and anxiety alongside. You have to think that these are people that have constantly been measured by how they are not performing how we expect them to in society. And there's a lot of judgment that enters into that. So you can see where somebody can very quickly become depressed and feel like they're not adequate or doing well or what they should be doing or as well as they should be doing because they're struggling with ADHD. This can also cause people to suddenly feel very overwhelmed or anxious about doing what they need to do to care for the people around them or care for themselves. And a lot of times we see people that have unfortunately tried to self-medicate using street stimulants, methamphetamine, cocaine. And so substance use disorder is also very common with people with ADHD, but we don't see that as often anymore.
If the ADHD symptoms improve, do you see the depression and anxiety improve as well?
Typically, it's more linked to how well their performance improves and whether the environment around them has a positive response to their ADHD symptoms getting better. So we do work comprehensively with the patient. We work with them on their mood. We prescribe antidepressants. We prescribe medication for anxiety alongside their ADHD medication if necessary, and we need to provide that support.
I'd like to ask you about the risk factors for ADHD. Is there anything that people can do to reduce their risk of developing ADHD?
It comes down to some of the theories of why do people get ADHD. We are finding that there is an increased incidence of ADHD, and we think it is coming from how we train our brains on a daily basis and how we interact with a lot of the technology out there. Flipping through the average length of a YouTube video when YouTube first came out was something like 15, 20 minutes. You're lucky if you see a 3 to 5 minute YouTube video nowadays. That's kind of the average length of time. So training your brain to constantly flip through shorts, TikToks, Reels on Instagram, or the way that you digest your news, if you never dive into and read through an article and really spend time focusing on a topic, you can start to train your brain to kind of behave like it has ADHD, even though you may not truly have ADHD.
That's pretty frightening, but that's research that hasn't been proven yet.
It's ongoing. We've got some preliminary studies that show, particularly children and adolescents. We're trying to repeat a lot of these studies with adults to see if they behave in similar fashion. And the early results say that adults are similar to kids. If you train your brain to have a short attention span by constantly scrolling through things, you're going to start looking like you have ADHD because you've trained your brain to pay less and less time and less depth of focus on an individual task or an individual item.
Well, before we wrap up, can you tell us about your role on the pharmaceutical subcommittee of the U.S. Guidelines Task Force for Adult ADHD?
My role there is we are putting together guidelines to try to help practitioners have kind of a playbook of how to diagnose, how to treat, and how to prescribe. And my specific role is on the prescribing subcommittee. So medication and what things to look for and talk about and consider before, during, and even after the symptoms of ADHD are present and diagnosed is what we're trying to provide people like me and other mental health and especially primary care providers, because a lot of the primary care providers out there are the ones that see this first and then it lands in my schedule. So we're trying to give them some ideas, some thoughts, and a little bit of a playbook on guiding their decisions and how they approach ADHD.
What is the best way if someone's listening to this interview and they think, I need to visit the adult ADHD clinic? Is there a way to do that, or do they need a referral through a primary care provider?
No, it doesn't require any kind of referral. All you need to do is you need to call the office at 315-464-2689. Or if that line is occupied, you can call 315-464-3265. Just specifically request an intake appointment with the ADHD clinic for adults, and we'll be happy to get you in our schedule.
Well, Mr. Ringhisen, thank you so much for making time for this interview. It's been very informative.
Appreciate you taking the time to speak with me.
My guest has been John Ringhisen, a nurse practitioner of psychiatry and behavioral sciences at Upstate, who oversees the adult ADHD clinic, and who's also a member of the pharmaceutical subcommittee of the U.S. Guidelines Task Force for Adult ADHD. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcast, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.